a warning for women who develop heart problems while pregnant. Studies suggest they have a 63% increased risk for cardiac disease, leading to a greater heart attack or stroke risk later in life.
Here to explain is Dr. Nandita Scott, director of the Mass General Brigham Women's Heart Health Program. Doctor, thank you so much for joining us this morning.
Thank you so much for having me here and for highlighting heart disease in pregnancy and women on your segment this morning. So pregnancy is an amazing time in a woman's life. We know that there's so many changes that happens during pregnancy, but the cardiovascular system has like these fantastic changes where your blood volume goes up, your heart rate goes up, and your cardiac output, which is actually the amount of blood your heart has to eject each minute, goes up by about 40 to 50%. The vast majority of women do fine during pregnancy, but actually cardiovascular disease is a leading cause of pregnancy complications during pregnancy. And unfortunately, about 1,200 women per year die in this country due to cardiovascular complications during pregnancy.
Very alarming, but do these heart problems disappear after delivery?
So after you deliver, it takes about a few months for your body to go back to your normal non-pregnant level. But unfortunately, we're seeing that women who have developed some pregnancy complications, such as preeclampsia or hypertension or high blood pressure during pregnancy, have a longer-term risk of cardiovascular disease, and that propagates over their lifetime. And it's unclear whether that is because these women were already at risk and it was that the stress test of pregnancy unmasked it earlier in their life, or was it because the pregnancy actually damaged their blood vessels and their heart that then caused these flows?
For women who develop one of these conditions during pregnancy, what do they need to know about other risks as they do get older?
Yeah, it's so important. The cardiovascular community has done a really good job of addressing the usual risk factors such as high blood pressure, high cholesterol, smoking, and diabetes. But we're realizing now that these unique risk factors to women are actually really important as well. So women should be aware that if they developed one of these complications, so high blood pressure during pregnancy, preeclampsia, diabetes during pregnancy, even things like placental abruption, where your placenta tears off your uterine wall, can increase their risk. So they should make their doctors aware. And what that means is that when your doctor is deciding whether to put you on therapy for, say, high cholesterol, they might trigger the medication start earlier because of this, what we call a risk enhancer.
Okay, thank you, Dr. Nandita Scott, the director of the Women's Heart Health Program at Mass General Brigham. Thanks for joining us and letting women know. Speak up, give suggestions to your doctor, too.